All right, Basics 101. This is a really important place to start, especially if you're new to hip circles, if you're new to my work, if you're new to pelvic health and women's health and really thinking about the pelvic floor muscles and your deep core muscles. You really need to start here. So, excellent. Let's get started. Go ahead and stand up, and I want you to join me as we think about and talk a little bit about the pelvic floor and the deep abdominals and how to connect with this part of your body, which is really the center of the Circle Solution journey that you're going to embark on with the hip circles and hip figure eights and all these other things you're going to learn. So where it all starts is the pelvis. Now, the pelvis is a bony structure in the middle of your body. Literally, it's straight smack dab in the center of your body. And this is where everything that we're going to be doing stems from. So your hips are actually the joints right here and here. Oftentimes when we say put your hands on your hips, we're going like this, but really you're putting your hands then on the pelvis. Your hip joints are right here. So when you're doing your hip circles, that is really going to be getting a nice decent amount of movement, the hip joints deep in here. So you may feel a little something waking up in your inner thigh area, and your outer hips are going to feel it too right in here. And then of course your deep abdominals, so the transversus abdominis are the deep abdominal muscles that go all the way around like a corset and actually hook into your spine by connective tissue, hooks into your low back. So those deep abdominals are going to feel a little something. Your obliques, which are the side abdominal muscles, are going to feel something. And I want you to know that you may feel muscles in a new way. You may be waking up muscles you haven't used in a long time. So even though the moves are fairly simple, and for some people it might feel like they're small and maybe going a little slowly, I encourage you to take your time with the program. You're going to be waking up new muscles. For other people, it's going to be too fast and you're going to need to slow the program down. Maybe take more rest breaks, maybe take more rest days in between the videos, so your 21-day Circle Solution might stretch to 31 days or 40 days. Take your time. For people with back pain especially, you might find that you're more sore in your muscles. Now, if you notice that you're feeling pain, you need to stop where you are, make the motion slower, smaller, more focused, and more controlled. It's very important. If you're just feeling some muscle soreness, know that that's normal. I don't mean to minimize it by saying just, if you're just feeling that, but if you're feeling some soreness, don't be scared, don't be alarmed. Again, know that these are muscles waking up, and it's a good thing. So again, these are the muscles we're focusing on in the Circle Solution: the deep abdominals, the obliques, the outer hip and glute muscles, the inner thigh and pelvic floor. So the pelvic floor is the group of muscles that are at the very base of your pelvis. They're like a little hammock that supports your pelvic organs, your bladder, your uterus, your rectum. All of those organs are supported by the pelvic floor muscles. So let's begin with some exercises that can really help connect you with these deep muscles we're talking about. So the first thing I want you to do is to focus on that pelvic floor. Think of gently squeezing and lifting the pelvic floor muscles like you are pulling a marble into your body, okay? So a gentle squeeze and lift. You'll feel this in the vaginal area and even a little bit in the anus area. So you're going to feel that gentle squeeze and lift. Now the most important part is a full release. Totally let it go. Now that's a Kegel. And Kegels are not something that's particularly a part of this program, the Circle Solution, but I want you to do this Kegel right now. Keep doing them as I talk actually. Do a Kegel right now so you can really kind of focus in on the base of the core, which is the pelvic floor. So you can focus in on those muscles and kind of connect with them and see what the basis of what we're talking about when we talk about this core, this inner core, and then the muscles we're using. Focus in on that area. Feel what I'm talking about. Do one more. So squeeze and lift, almost like it's an elevator. The doors are sliding shut. And then lift that elevator, your pelvic floor muscles. Lift it up. And then release down. And if it was an elevator, slide those elevator doors open. So a squeeze and lift and a full release. That's a Kegel. Now, one thing I will mention in the Circle Solution videos is the concept of zipping up. So what I mean when I say to zip up is to engage these core muscles that I've been talking about by starting at your pelvic floor. So do the most tiny, gentle Kegel. So that same thing we just did, the squeeze and lift. And then pull in your deep abdominals, starting at your right above your pubic bone. Pull in those deep abs. Now, it's not a strong clench. It's just a gentle pulling in, like you are zipping up a slim-fitting pair of jeans that have a real high zipper. So feel that gentle pull in. And then if you feel that your lower ribs are popping forward as you do that, don't let that happen. Pull them back. So you're nice and engaged and strong through the entire deep core. With your shoulders, you roll down and back. Now, I do explain this posture, the dancer's posture, and I briefly explain the zipping up in the videos you're going to view on the Circle Solution, but I want you really to make sure you have the concept of what we're focusing on when we focus on the core, what we're focusing on when I say to zip up, what muscles we're trying to activate with this program. Now, let it go, totally release, and again, know that if I tell you to engage your core or to use those muscles or to zip up, that's what I mean, zip up. I want you to practice right now 2 times, releasing everything, letting it all go, shimmying it out, and then zipping up. So pelvic floor engages, low abs pull gently in and up, lower ribs pull in, shoulders roll down and back. Release. All right, now, one more time. Little gentle Kegel, lower abs pull in, lower ribs pull in if they popped forward, roll your shoulders up and back, nice and zipped up and strong, and release. All right, I want you to breathe now. So one thing that we do in the program is incorporate breath and movement just a bit. It's a real important piece, but the more you can do it on your own, the better off you're going to be. So I want you to focus on breathing down into your pelvic floor, breathing into your pelvic muscles, breathing into your lady bits, breathing into that area down low. So when you breathe in, I want you to let your belly release, let your lower ribs expand, your pelvic floor expand, and when you breathe out, I want you to feel your pelvic floor lift and your belly gently draw inward. This occurs as your breathing diaphragm naturally rises when you breathe out. Now when you breathe in, again, breathe in, your diaphragm comes down, your breathing diaphragm comes down. Let your belly expand, your pelvic floor expand, everything expands. Again, this is as you inhale, and then as you exhale, everything lifts and pulls in. So when you breathe in, your diaphragm naturally comes down. Your pelvic floor can relax and your low belly can relax. Everything expands at this time. When you breathe out, when you exhale, your breathing diaphragm naturally comes up. You don't even have to think about it, it just happens. And that's when your pelvic floor can lift and you can do a gentle Kegel and gently draw in your abdominals as well. So you want to always think about exhaling with exertion. And this can help you in all aspects of your life, not just the Circle Solution. But think about exhaling with exertion because that's going to help reduce downward pressure on your pelvic floor and help you naturally strengthen and exercise the deep abdominal and pelvic floor muscles. When it comes to hip circles, what I want you to think of is when you're pulling in your abdominals, when you come forward with your circles, you're going to be lifting your pelvic floor and exhaling. So I want you to keep that in your mind. And right now, let's do one more exercise that's going to help you get the hang of this exhalation with exertion and the pulling in your low tummy with exertion. So this is what we're going to do. It's called Breath of Fire. It's a wonderful breathing exercise, and it'll really help you connect in with your pelvic floor, your deep abs, and your breathing. So you're going to think about just letting everything be relaxed. And I want you to, when you exhale, so I want you to lift your pelvic floor gently and pull in your abs. So you're going to do your breathing like a bellows, like you're pressing a bellows. And I want you to exhale repeatedly. You don't have to do it quickly, but as you exhale, you're pulling in your belly, and you're also going to allow your pelvic floor to lift just a little bit. So I'm going to show you. If you're not feeling the pelvic floor and you're just focusing on the abs, that's okay at this point. You'll be able to integrate more of it as you go on and you get more familiar with working with this part of your body. But again, for now, just start with pulling in your low abs, kind of starting at that area right above the pubic bone and feeling like you're pulling in and lifting, pulling in and lifting. If you've done this before, you can go a little faster. Now keep going, and you'll notice that you don't even have to think about inhaling. Just focus on the exhalation. Your body will naturally get the air it needs. Just focus on the exhalation and stop if you feel at all dizzy or lightheaded. You only want to do 10 to 15 reps at a time and then take a nice break where you just shake it out, breathe, let it go, and then you can do one more round. So join with me. Go at the pace that works for you. And again, we're just connecting in with this part of our body. So let it go. So you can practice that anytime you want. And like I said, it's a wonderful way to ground, to get present in the moment, to connect with this part of your body, and to really kind of wake up those core muscles. Now, if you have prolapse, I have a specific tip for you when you're doing your hip circles. As we talked about, it's important to exhale with exertion and to learn how to feel that gentle lift or kind of sealing off of the pelvic floor as your diaphragm lifts as you exhale and pull your belly in. It all happens at the same time. So it's like a lift, pull in and lift of everything. Now that pelvic floor supports your pelvic organs. Now, if your prolapse is severe and you need to use a pessary or a device to lift everything up back into place, then it's helpful to use the pessary during the circle solution and to follow what I'm about to tell you at that time. But if you have mild to moderate prolapse, you may not need the pessary and you can still feel the support that I'm about to share with you. So what I want to share with you is when you're doing your hip circles, I want you to think about as you come forward with your circle, which you're going to learn more about, just keep this in mind for now. As you come forward with your hip circle, that's when you're really contracting the abdominals. You're going to feel it in the abdominals. You can feel it right now with just a little scoop forward of your pelvis. So when you're coming forward, you're going to want to think about lifting the pelvic floor, so doing a little kegel, pulling in your abdominals, and exhaling. So you might need to make the circles slower so that you have time to lift your pelvic floor, pull in your tummy, and exhale at the same time. Release. Lift up your pelvic floor, pull in your low tummy, and exhale all at the same time as you come forward. Release. Pull up your pelvic floor, pull in your low tummy, and exhale all at the same time. Release. Like I said, you can always go slower. So learn how to get that coordinated pulling up of the pelvic floor with your little mini kegel, gently pulling in of your low abs, and the exhalation all at the same time, and then release. So that's really important for people with prolapse. Let it go. If you have back pain, this is really, really important for you to know. I have already said it, but I'm going to restate it again. You might need to go slower with the videos. You might need to do each video 3 or 4 times before moving on to the next one. You might need to intersperse more rest days so that you're not, in the schedule it has you doing 2 videos. You only have a couple of rest days throughout the program. But you can intersperse more rest days if you need them, if you're feeling some soreness. Again, pain, you want to check in with me, check in with your healthcare provider if you're already working with a physical therapist. You want to be careful of that. But for soreness, just intersperse more rest days and make the motions smaller, more controlled, and just keep it gentle. Take your time with this. I also want to give you a link to another video that you may want to start with before doing any of the circle solution. You might want to just push pause on the whole program right now and try this video that I'm going to link to. You're going to go ahead and see the link above, to the side, below. It depends on the device you're viewing this on, but press that link. It is called The Hardest Quarter Inch You'll Ever Move, and it really shows you how to wake up and work the deep transversus abdominis muscles, the deep ab muscles. Really important if you have back pain to know how to activate those muscles safely and effectively, and it may be helpful for you before beginning the Circle Solution program or as you're starting the Circle Solution journey to practice the exercise that is in this video. So again, it's called The Hardest Quarter Inch You'll Ever Move, and I think it'll really help you out. Remember, consistency is key, and I do encourage you to do these circles as described in the schedule, or taking a little longer than the schedule describes, but doing them consistently. Don't do the exercises and then take a week off and then do them again, because it might be too jolting and jarring for your body. You want some consistency, you want some regularity, and you want to practice them so you can get to that full routine and just have fun with it. And then after the circle solution is over, you're done with the videos, keep doing circles every single day. 3 to 4 minutes, even just 2 minutes, every day, getting that flowing multiplanar movement, the delicious circles or hip figure eights or bust circles or single hip circles. You're going to learn all of this, but it's going to help you feel better every day of your life for the rest of your life. I hope this basic video helped you begin to connect with the core. Please from here move on to the Stretch and Strengthen Prep, which is in your video portfolio of the Circle Solution. And then from there, you'll do each video, the instructional videos, 1 through the final routine at the end. So make this a gradual progression and have fun with it. If you have any questions or concerns, you can always email me, you can message me on Facebook, or you can take part in the private Facebook group that is part of the Circle Solution. So thanks for watching.